The health department says it will be embarking on a vaccination campaign to contain a diphtheria outbreak in the Western Cape. Now, this comes after a 19-year-old Pollsmoor Prison inmate succumbed to this bacterial infection last week. At least 10 positive cases have also been reported in the province. The Correctional Services Department will be giving an update on the outbreak at the prison this morning. But let's bring you the perspective of provincial health. We're joined this morning by the Health MEC in the Western Cape, Luke Albert. It's great to talk to you. Thanks very much indeed for coming on. Are you concerned? We know that there's been this case in Pollsmoor Prison. There are 10 cases as well. Where does your level of concern go insofar as outbreak is concerned? It's at the prison itself, but provincially?
Good morning to you and to your viewers. Thank you very much for having me on board. Just for clarity, I'm the MEC spokesperson, not the MEC itself.
Thank you for that.
No worries. So right now, the outbreak is contained within Block A of Pollsmoor Correctional Facility. There isn't any other cases that are confirmed outside the facility. So far, there are only 8 confirmed cases, of which 6 are having mild symptoms, and the rest are asymptomatic. The 9th patient was the index case, which was the 19-year-old boy who was confirmed on the 28th to have contracted diphtheria and who sadly passed away on the 5th. They are doing testing and updates on a regular basis, so we will see how it goes, but for now it's solely contained within Block A of the Pollsmoor facility.
I see. This is concerning, right? Not least because the vaccine for diphtheria is contained in childhood vaccines. It's one component of the hexavalent vaccine. What is this telling us about whether we are up to date with these shots?
Well, it does raise concern because, as you know, diphtheria is a very uncommon but preventable disease, and we do have an established child vaccine program that starts from shortly after a child's born, and then they have various boosters at 6 and 12 years old. So it shows that a lot of residents, not necessarily a lot of residents, but residents aren't necessarily taking their children to get routinely vaccine. Now, there could be a host of reasons for them. I suppose we don't have to go too deeply into that, but it shows that there is either structural causes preventing parents or children from getting their vaccines, despite them being available during our vaccine drives at schools, and also perhaps vaccine hesitancy following COVID-19. And it speaks to the fact that we really need to double down on in taking down those fears, those worries of any vaccine, and ensuring that our children get the vaccines they need.
Yeah, so hesitancy as a result of COVID-19, but, we've always said in the wake of the pandemic that we would see in the coming years what the impact of COVID would be, right? And one just wonders whether the delay that perhaps we saw in people getting their vaccines for whatever reason during the pandemic, whether we can trace it back to the height of the pandemic.
Definitely. I mean, there's no doubt that COVID-19 had an impact on our primary healthcare facilities. With COVID and its healthcare services being prioritized, certain services were not necessarily stopped, but they were stalled. And if you had a child during the pandemic and there were high levels of lockdown and you couldn't necessarily gain access to your primary healthcare facility, then I'm sure there will definitely have been impacts on how a child's immunization would have occurred during its early stages of its life, especially if it happened during COVID.
Yeah.
There will always be people who have concerns about vaccines prior to COVID, but COVID definitely had an impact on the perceptions of vaccinations, and beyond that, like I just said, the access to healthcare facilities definitely had an impact as well.
Yeah, absolutely. So, Luke, you've told us about the response that will now take place in prisons, right? This outbreak of cases, this group of 8 cases identified in Block A of the prison. Are we concerned that the greater province is also at risk?
I don't think there's a need to be to raise concerns too much. Obviously, our clinicians and physicians and healthcare workers have been instructed to raise their level of suspicion, especially if they come across any symptoms that could be related to diphtheria. already within the health in the facility, 378 inmates and correctional facility workers have been vaccinated since the case has been identified. We are ensuring that the vaccines are being readily available at our clinics and our primary care facilities for our residents, and also staff members within the substructure under which Pollsmoor falls are being vaccinated and having their top-ups done. So we are taking necessary precautions. We are being cautious, but there's no need to be having heightened concern at this point in time because it is isolated within the facility. Mm-hmm. The inmates who currently have the confirmed cases are in isolation, and we have done contact tracing of those who have been in contact of those various patients over the past week. Obviously, those tests will be need to be processed first, and we'll get updates on a daily basis as to what the current status is. But for now, it is contained in the facility.
So two things now. Perhaps you can give us a sense just of what the symptoms are and what we should be looking out for. And then I suppose the next course of action is for all of us to have a look at our vaccination cards, right? Make sure, yet again, that your children are up to date.
Exactly. So one of the first symptoms you'll have is a sore throat, and tonsil area and sort of swelling glands in your neck. And if you have any of those symptoms and you are worried, then it is good to go get checked up by a physician for them to determine if there are any other underlying symptoms. But general flu symptoms apart from and the neck and sort of swelling glands and pains in that respect will be one of your first indicators. If you have had your vaccine, you shouldn't be too worried, but again, precaution is key here, and you should always go to your physician to ensure that you do not have any bacteria, should that cause be confirmed. And
Luke, can you just as a point of clarity, the health department will, even though it's, as you say now, vaccinated 370-odd inmates, it will also be embarking on a province-wide vaccination campaign, is that correct?
Well, no, I won't say province-wide just because of this case. We are elevating sort of suspicion and focus from our healthcare workers to look out for symptoms, and we are encouraging parents to take their children for vaccines. Okay. And their boosters as well. Those services are still readily available at our facilities, and that hasn't changed since this confirmation of diphtheria. But we are taking precaution, ensuring that our healthcare workers are, especially within the substructure under which Pollsmoor falls, that they are being vaccinated. Yeah. Yes, but those are precautions for now.
And then the Correctional Services Department will also be giving us an update on the outbreak at Pollsmoor Prison. Luke Alberts, let me thank you for your time this morning. He's not the MEC, but he is the MEC's spokesperson. That's for health in the Western Cape.